Hey everyone, Dr. Mike here for the supper. We're your go-to source for all things health. And today we're diving into the top 10 recent healthcare updates you absolutely can't miss. From groundbreaking technology to major legal battles, these stories are shaping the future of healthcare as we know it. So grab your coffee, get comfy, and let's get started. Now, I'm passionate about medical training and using the latest technology to improve patient care. That's why I'm so excited about this first update. Endo, a company specializing in surgical simulation, just launched a game changer. They're incorporating Apple Vision Pro into their training platform. This means future surgeons will experience an entirely new level of immersion. Imagine, instead of staring at a two-dimensional screen, they'll be thrown right into a realistic, three-dimensional operating room using augmented reality. This hands-on experience will be invaluable for honing their skills, boosting their confidence, and ultimately leading to better outcomes for patients. And the best part? Endo is planning a wide rollout, making this cutting-edge technology accessible to medical institutions across the board. It's a win-win for everyone. In a surprising turn of events, Wells Fargo just dodged a massive lawsuit. They were accused of driving up drug costs, but the court dismissed the case, citing lack of evidence. This is a big win for Wells Fargo, but it highlights a larger issue: the lack of transparency and accountability in the pharmaceutical supply chain. PBMs, or pharmacy benefit managers like Wells Fargo, play a huge role in negotiating drug prices. The lawsuit claimed they were engaging in shady practices that inflated prices for everyone. While this case was dismissed, it shines a light on the urgent need for greater oversight and regulation in the pharmaceutical industry. This isn't over, folks. Okay, this one's a bit of a headshaker. Walgreens, the pharmacy giant, agreed to pay a whopping $5 million to settle a Medicaid fraud case. Now, you might be thinking, $5 million? That's chump change for a company that big. And you'd be right. But this settlement highlights a disturbing trend of billing irregularities within the company. It seems Walgreens has been overcharging Medicaid for years. This case serves as a stark reminder that even the biggest names in healthcare aren't immune to scrutiny. We need to hold these corporations accountable for their actions, especially when it comes to taxpayer-funded programs like Medicaid. This settlement is a step in the right direction, but we need to remain vigilant and ensure transparency within the healthcare system. The Department of Health and Human Services, or HHS, announced major job cuts aiming to save money. While saving taxpayer dollars is important, many are concerned about the potential consequences for crucial health programs. The HHS oversees Medicare, Medicaid, the CDC, and the FDA, just to name a few. These agencies are already stretched thin, and cutting jobs could impact their ability to serve the public effectively. Will this lead to longer wait times, reduced services, or even compromised safety? It's a question that has many healthcare professionals and patients deeply concerned. We need to find a balance between fiscal responsibility and ensuring access to quality healthcare for all. The Supreme Court is about to make a decision that could have a monumental impact on women's healthcare. They're currently reviewing a case that directly challenges Planned Parenthood's federal funding through Medicaid. Now, this isn't about politics, it's about healthcare. Millions of Americans, particularly low-income women, rely on Planned Parenthood for essential healthcare services, including cancer screenings, contraception, and STI testing and treatment. A decision to strip Planned Parenthood of funding could have devastating consequences for women's health across the country, limiting access to vital healthcare services. This is a case we all need to pay close attention to. In a controversial move, a top FDA vaccine regulator, Dr. Marks, is leaving the agency. This departure comes amidst growing scrutiny of the FDA's vaccine approval process, particularly regarding COVID-19 booster shots. Some see this as a necessary shake-up, while others fear it could undermine public trust in vaccines. The timing of Dr. Marks' exit raises questions about potential political interference in scientific decisions, which is never a good look. The FDA plays a critical role in ensuring the safety and efficacy of our vaccines, and it's crucial that they operate with transparency and maintain public trust. This situation is definitely one to watch closely. Former President Trump recently signed a series of executive orders aimed at reshaping the healthcare landscape. These orders target key areas like prescription drug pricing, surprise medical bills, and access to healthcare plans. While the intentions behind these orders might seem well-meaning, their practical effects remain uncertain. Critics argue that these executive orders lack concrete details and could potentially disrupt existing healthcare frameworks without offering viable alternatives. It's still too early to tell how these executive orders will play out in the long run, but they've definitely added another layer of complexity to an already intricate healthcare system. The demand for mental health services has skyrocketed in recent years, and finally, we're seeing some progress. We're witnessing a surge in the number of behavioral health urgent care centers popping up across the country. These specialized facilities offer immediate care for mental health crises, providing a much-needed alternative to overwhelmed emergency rooms. To address staffing shortages, many centers are turning to AI-powered tools for tasks like scheduling and administrative support. This allows mental health professionals to focus on what matters most: patient care. While there's still a long way to go, the growth of behavioral health urgent care is a positive step towards addressing the mental health crisis in this country. The nursing profession is embracing the future with open arms, incorporating artificial intelligence into education and training programs. AI-powered simulations are transforming the way nursing students learn, allowing them to practice complex procedures and develop critical thinking skills in a safe and controlled environment. This technology provides instant feedback and personalized learning experiences, enhancing the overall effectiveness of nursing education. However, some educators express concerns about over-reliance on AI and the potential loss of the human touch in healthcare. We've all seen the devastating effects of the opioid epidemic. The good news is that we're finally making progress in combating this crisis by exploring alternative pain management options. Non-opioid therapies are gaining traction, with doctors increasingly prescribing safer alternatives like physical therapy, acupuncture, and even mindfulness techniques. Pharmaceutical companies are also stepping up to the plate, investing heavily in the development of new non-addictive pain medications. This shift away from opioids marks a significant turning point in pain management, prioritizing patient safety and long-term well-being. We need to continue to support research and development in this area to provide those suffering from chronic pain with safe and effective treatment options. That's it for today's Healthcare Rundown. I hope you found these updates informative and insightful. Remember, staying informed about the latest developments in healthcare empowers you to make better decisions for yourself and your loved ones. Don't forget to hit that subscribe button and the notification bell so you never miss an update from the supper. Until next time, stay healthy.